the CHPS compound, structures, quality, and what we need to do to improve quality. Ode asked that question. So since we left off with you, Mustapha Gbande, let's start off with you then.
Okay, so Ode's question, the CHPS compounds project was actually started by the NDC. And the rationale behind it is to help the country gain accessibility to healthcare. We have places that you cannot travel to. When it rains, nurses cannot go. We've seen nurses being caught up by streams overflowing and all of that. So why don't we have, and you cannot go and put a hospital in a place where the income cannot service the hospital. So why don't we build CHPS compounds to service polio, to service kids, healthcare, to deal with all these diseases that comes up. Today, those CHPS compounds have been abandoned. They are not being used. Two.
And when you say they are abandoned, are you saying that on fact you have evidence to prove what you're
anything that the NDC does, as soon as the MPP came to power, it's about the NDC and John Mahama. It has never been about Ghana. It has never been the issue that let us look at the people who are benefiting from these things so that we continue for the purposes of public service and accessibility to healthcare.
I get that. So the NDC, if granted that this has been abandoned, what is the alternative?
The NDC will always continue these projects when we come back. They will still be CHPS compounds so that in my village, where we have 100 people in a community, they have a nurse who can attend to their first aid needs. Children are being born in those communities. They can have access to early childbirth care. They can have issues with care that prevents this polio and all attacks that affect our kids in the villages.
So his concern, one is about structure.
Yes.
Then you have the aspect of the workers, I believe.
Yes.
The workers as well.
You remember President Mahama initiated the abandonment and abolishment of nurses' allowance. The rationale was so that we can save money, increase the number of nurses that can be trained at a particular time, so that we don't go into, say, the budgetary constraints only can train 1,000 nurses, where we need 2,000 nurses. If we save that allowance, we'll train 2,000 nurses. Every village can have a nurse to go and man a CHPS compound. At the same time, what the nurses do is that government gives them a loan whilst they are in school, so that when you start working, you pay back the loan. That was the rationale for that. And it is supposed to make sure that we're able to decentralize healthcare and make it very accessible to the ordinary Ghanaian who are disadvantaged and deprived. And so those policies will certainly be continued when the NDC is open. Look, recently, Global Fund is a donor to Ghana Health Services. Even when we are complaining about we don't have money and all of that, external shocks, Ukraine, COVID, and all of that, Global Funds donated medicines to the people of Ghana, but because of a bad government, they left it at Tema Harbour, and the medications got expired. These are dangerous people in power. If you go on that trajectory where a government does not realize the importance of some of these services and urgent actions that are required to save lives, then we are in danger.
Okay, to summarize your solution and what you would be doing as a political party,
I've told you that we'll continue.
You continue the construction of the structures, and then you're coming back with the removal of quota when it comes to the nursing or the training, the nursing training.
No, I just explained the rationale, the policy framework, the linkages
continue
around. We will continue it. I mean, certainly.